Thank you all for allowing me to come by and talk a little bit about one of my favorite subjects, which is healthcare. And the healthcare debate is far from over in this country. Yes, Congress passed a comprehensive bill in the last Congress, and yes, the new Republican leadership in the House has passed a repeal of that bill that will not get through the Senate or be signed by the President. But that's not the end of the healthcare debate. This is a subject of continued interest, and it's a continuing effort. So I'm glad that we have a chance to talk about it, because I want everyone to be more informed about our healthcare system. We start with the fact that in the United States of America, we have the best healthcare in the world. If you have a complicated illness, or you want to get your doctors trained, you come to Johns Hopkins and University of Maryland Medical Center and the great institutions here in America. But we have problems with our healthcare system in this country. Very, very serious problems. And the purpose of the bill that was passed by Congress, the main purpose of the bill was to do two things. First, it recognizes that if we're going to have a great healthcare system, everyone needs to have access to healthcare. And millions of Americans did not have access to healthcare. So the first goal of this bill was to bring everyone into the system. And the Congressional Budget Office, and I will be referring to them, they're the independent scorekeepers, tell us that about another 30 million Americans will be in the system when we fully implement the bill by 2014. But the second major purpose was to get a handle on the escalating healthcare costs in America. Healthcare costs is going up at a very, very rapid rate. It has been. Much higher than people's incomes are going up. Their healthcare costs are going up. You know that. Your families know that. And we want to get a handle on reducing the growth rate of healthcare costs. So the main thrust of this bill was to invest in primary health care, prevention, health information technology, better management of severe diseases, earlier detection of diseases. All that is included in this bill.